Coming at you live from the Itty Bitty Kitty Kitty Studios. It's KAR News with our hosts Katie Couric and Dick Wayne.
Welcome back to Channel 13 News on KAIR. I'm Katie Kirk.
And I'm Dick Wayne.
Today's story, Obamacare and its impact on our nation.
The House of Representatives recently voted for the 56th time to repeal Obamacare. Obamacare, also known as the Patient Protection and the Affordable Health Care Act, was signed into law to reform the healthcare industry by the President Barack Obama on March 23, 2010, and upheld by the Supreme Court on June 28, 2012.
Obamacare's goal is to give more Americans access to affordable, quality health insurance and to reduce the growth in the U.S. health care spending. From the past deadline of 6.5 million people enrolled, 4.5 million were renewals, and 2 million new enrollments. And now to our correspondent, to Trisha Takawana at the Capitol.
Thanks, Katie. Hi, I'm Trisha Takawana, live from the Capitol building. Let me tell you something about Obamacare, okay? Almost 30 million people have had their insurance plans canceled by insurance companies because the plan doesn't meet the 10 essential health benefits. 3 to 5 million American citizens could lose company-sponsored health care plans. Outrageous. And let me tell you this. In 2013, taxes were raised on 1 million individuals' incomes exceeding $200,000. And 4 million couples filling jointly on incomes exceeding $250,000. Don't even get me started on the pharmaceutical companies that pay an extra $84.8 billion in fees over the next 10 years to pay for closing the donut hole in Medicare. That could raise the cost of drugs. People need that. People rely on that kind of thing. Come on, Obama. Obamacare forces a very, very complex, one-size-fits-all health system. Obama, everybody is different. Not every single American citizen's foot is going to fit in your Obamacare shoe. 25% of people making less than $25,000 a year were uninsured. And those who don't sign up must pay extra on income tax. We don't need any more of that. We don't need any more tax, Obama. And get this. Obamacare allows illegal immigrants to use preventative health care. What Obama doesn't understand is that this encourages immigration, Mr. Secure the Border. The House of Representatives has recently voted for the 56th time to repeal Obamacare. And I say good on them. I say we stand by them. I say all American citizens band together, go online to www.therepealpledge.com. Sign it, we repeal Obamacare. Thank you.
Okay, thank you, Rachel. Now to Isaiah on the other side of the Capitol building. What do you have to say about this?
Thank you, Adam. I'm here on the other side of the Capitol building, where I'm going to tell you all the good things about Obamacare. Let me start off by saying that 10 to 12 million people are now insured thanks to the program. And a recent study shows that people who get health insurance from the program are significantly less likely to experience financial distress and are significantly more likely to report better mental health. On top of that, insurance companies are no longer allowed to deny coverage for anyone with pre-existing conditions. They can no longer drop them from insurance plans, and they can no longer raise premiums once they do get sick. Furthermore, Obamacare expands Medicaid to people 138% below the federal poverty line. This provides coverage to adults without children for the first time in history. And Rachel mentioned earlier that Obamacare has 10 essential health benefits that need to be included in your insurance plan. But these benefits include treatment for mental health, addiction to drugs and alcohol, and other such things, and chronic disease. This helps keep people away from the emergency room, which is a huge load off the American citizens' wallets. Because uninsured emergency room visits cost either $150 to $3,000, but there are cases where critical care is required, in which case it could reach up to $20,000. So, I don't know about you, but I don't have $20,000 just lying in my pocket. And finally, the main focus of Obamacare is to lower the budget deficit by $143 billion over the next 10 years, and it does so by lowering healthcare costs and shifting cost burdens to healthcare providers and pharmacy companies, and also it raises taxes. And let me say, that makes a lot more sense, because big companies are able to handle that burden more easily than just your average citizen working at, a minimum wage job. So that's all I have to say, and I'm done.
Hey man, have you heard of that new affordable healthcare thing?
Yeah, what about it?
Yeah, have you signed up for it?
How do you know healthcare? Look at me. Picture of health, man.
I don't know, man. You never know what's a big bad could happen. Whoa, man, you okay?
Yeah, man, I'm alright. Dude, what's wrong? Looks like I'm gonna need healthcare.
So sign up for healthcare right now at healthcare.gov.
Thanks, Obama.
Hello, welcome back to KAIR News. I'm Rachel, and joining me here today is Not Isaiah, expert on Obamacare.
Hello.
You know what? Let's just get right into it. Isaiah, please enlighten us and give our audience a quick summary on what Obamacare really is.
That's a really good question, Rach. Can I call you Rach?
Yeah, I prefer you didn't.
Okay, Rach. You see, Obamacare, or also known as the Affordable Health Care Act, is U.S. law aimed at reforming the American healthcare system. Obamacare's main focus is on providing more Americans with access to affordable health insurance, improving the quality of healthcare and healthcare insurance, regulating the health insurance industry, and reducing healthcare spending in the United States.
So, Not Isaiah, what is it that you have to say to all the critics out there who believe that Obamacare is socialist?
All I have to say is this. The U.S. spends more money on healthcare than any other nation in the world. That's largely due to private corporations owning our healthcare system. And with Obamacare, the government steps in and helps alleviate a lot of that cost. And it helps us catch up with other developed nations. So is it socialism? Not exactly. But hey, I mean, if we need socialism, then so be it.
Oh my gosh. You're so bold.
Thank you.
Earlier in the program, Trisha Takawana and Isaiah mentioned the 10 required health benefits. Could you elaborate on what that is?
That's a great question, Rach, and I would gladly answer that. You see, the 10 required health benefits are 1. Ambulatory patient services, or outpatient care. What this is care received without being admitted to a hospital, such as at a doctor's office, clinic, or same-day surgery center. Also included in this category are home health services and hospice care. But note that some plans may limit coverage to no more than 45 days. The second required benefit is emergency services, trips to the emergency room. It's care that you receive for conditions that could lead to serious disability or death if not immediately treated, such as accidents or sudden illness. Typically, this is a trip to the emergency room and includes transport by ambulance. You cannot be penalized for going out of network or for not having prior authorization. Third benefit is hospitalization. This is care that you receive as a hospital patient, including care from doctors, nurses, and other hospital staff. Laboratory and other tests, medication you receive during your hospital stay, and room and board. Hospitalization coverage also includes surgeries, transplants, care received in skilled nursing facilities, such as a nursing home that specializes in the care of the elderly. Number 4 is maternity and newborn care. That's when a woman receives care during pregnancy, throughout labor, delivery and post-delivery, and care for newborn babies. Number 5, the fifth benefit, is mental health services and addiction treatment. Inpatient and outpatient care provided to evaluate, diagnose, and treat a mental health condition or substance abuse disorder. This includes behavioral health treatment, counseling, and psychotherapy. Note that some plans may limit coverage to 20 days each year. Limits must comply with state or federal laws. And number 6 is prescription drugs. Everyone knows that prescription drugs are prescribed by a doctor to treat an illness or condition. Examples include prescription antibiotics to treat an infection or medication used to treat an ongoing condition such as high cholesterol. At least one prescription drug must be covered for each category. In the classification of federally approved drugs, however, limitations do apply. Some prescription drugs can be excluded. Over-the-counter drugs are usually not covered even if a doctor writes you a prescription for them. Insurers may limit drugs they will cover, covering only generic versions of drugs where generics are available. Some medicines are excluded where cheaper, equally effective medicine is available, or the insurer may impose step requirements, which is expensive drugs that can only be prescribed if the doctor has tried a cheaper alternative and found that it was not effective. Some expensive drugs will need special approval. You getting all this, Rachel? Okay. The 7th benefit includes rehabilitative services and devices. Rehabilitative services help recovering skills like speech therapy after stroke, and habilitative services help developing skills like speech therapy for children. And devices to help you gain or recover mental and physical skills lost to injury, disability, or a chronic condition. This also includes devices needed for habilitative reasons. Plans have to provide 30 visits each year for either physical or occupational therapy, or visits to the chiropractor. Plans must also cover 30 visits for speech therapy as well as 30 visits for cardiac or pulmonary rehab. Benefit number 8. Laboratory services. This is testing provided to help the doctor diagnose an injury, illness, or condition, or to monitor the effectiveness of a particular treatment. Some preventative screenings, such as breast cancer screenings and prostate exams, are provided free of charge. Number 9. Preventative service, wellness services, and chronic disease treatment. This includes counseling, preventive care, such as physicals, immunizations and screenings, like cancer screenings, designed to prevent or detect certain medical conditions. They also care for chronic conditions such as asthma and diabetes. And finally, number 10. Pediatric services. This is care provided to infants and children, including well-child visits and recommended vaccines and immunizations. Dental and vision care must be offered to children younger than 19. This includes 2 routine dental exams, an eye exam, and corrective lenses each year. And there you have it. All 10 of the 10 required health benefits in Obamacare.
Enlightening things, Not Isaiah. Thank you for being on the show.
Thank you for having me.
Now back to you, Dick.
Thank you, Rachel. And that concludes our broadcast for tonight at KARR Channel News 13. Tune in tomorrow night for the top story, cat videos. Too cute or not cute enough? Thank you. Good night and good news.